Welcome to Mom Care Month 3. It has been 3 months since you welcomed your baby to your family. Now you may be getting excited and ready to return to work after the birth of your little one. This can be a time of many emotions. You're excited to get back to a job or career you love, while at the same time you may be scared or sad about leaving your baby with a babysitter or at daycare. This module will walk you through some important steps in this new journey of returning to work. During this module, we will address the following topics and questions. Separation anxiety. What are my rights when returning to work? How do I maintain my milk supply? Pump bag essentials, important nutrients of focus, and meal planning techniques. Separation anxiety. If you are returning to work soon or wanting to take a break from caring for your baby or going on a date with your significant other, it may be helpful to start to get your little one used to being with someone else. It is often harder for the parents than the baby to be left with a new caregiver or be away from you all day. However, most infants under 7 months generally adjust well to the change in caregiver. Planning and being prepared for the first drop-off can make the transition easier for both the parent and child. It may sound and feel silly to talk to your baby while nursing or feeding about changes in the routine. However, talking about the changes can be helpful for you and baby. Arranging a visit with the new caregiver can help make your baby and you feel more comfortable. Taking a favorite stuffy or blanket can also make the transition smoother. Try to time the separations when your baby is happy, awake, and feeling well, since separations can be harder if your baby is tired, hungry, or sick. If you are planning on taking your baby to daycare, see if you can have planned visits prior to your baby's start so your baby can become acquainted early to the staff's voices, faces, and environment. What are my rights when returning to work? Going back to work after your baby was born is exciting, emotional, and possibly more difficult than the first few weeks of being home with your new baby. Going back to work brings more emotions and logistics to figure out. However, continuing to nurse your baby and pumping at work can be done. We will talk about what your rights are regarding where and when you pump and discuss proper storage of your expressed milk. First, according to the Patient Protection and Affordable Care Act, you have the right to pump at work in a private space, not a bathroom, and must be provided breaks and a reasonable amount of time to pump. A reasonable amount of time will vary for every mom. However, on average, it will take 15 to 20 minutes to pump, plus time to get to the pumping room, to set up, store milk, and clean up equipment and space. So it will take approximately 30 minutes in total. Early discussions with human resources and your supervisor are important for planning a successful transition back to work. Discussing expectations, productivity, and resources available to you as a nursing mom are important places to start in order to understand all of the accommodations and adjustments you will need to make to your daily work schedule. How do I maintain my milk supply? Setting a pump schedule that matches the frequency of when your baby would nurse at home will help you maintain your milk supply. Being away from your little one may slightly decrease the amount of milk you express at work. Letting go of stress and being comfortable while pumping is important. When pumping at work, consider looking at pictures or watching videos of your baby. Massaging your breasts while pumping can help increase the amount of expressed milk, and warm compresses can help with producing more milk. Try using hand warmers for winter outdoor sports as a warm compress. They're less mess and will last about 8 hours, perfect for most workdays. For more information about pumping at work, storing milk, and maintaining your milk supply when returning to work, please reference the attached handouts, Breastfeeding, Returning to Work, Breast Milk Storage Guidelines, and Maintaining Breast Milk Supply While Working. While eating enough food or calories is important for supply maintenance, it is equally important to create the demand for milk. During the transition back to work, you will want to continue to nurse your baby or pump to keep the demand for milk up. The more often your baby nurses or you pump, the more milk you will have. After a day at work, unwinding with your little one nursing is a great way to bond, snuggle, and de-stress after being apart all day. Eating when hungry and drinking fluids when thirsty is always the best rule of thumb for ensuring you are eating and drinking enough. You don't need to drink extra fluids unless you are dehydrated. Breast changes are normal as you nurse your baby. Initially, your breast may be hard and feel full as your milk supply comes in and your body starts to regulate your supply. At around 6 to 12 weeks, your supply will become more regulated and your breasts will feel softer and less full. And you should be experiencing less leaking, although it may be a good idea to have some nursing pads with you at work to be prepared for leaks as you get used to your new pumping schedule. The changes in your breasts does not mean a change in your supply. Instead, your body has figured out the right amount of milk to produce for your baby. Please keep in mind the amount of milk you produce pumping is not necessarily the same amount your baby will pull from your breasts. Your baby is more efficient than any pump at removing milk from your breast. Pump bag essentials. We have already mentioned a few items to have in your pump bag to help with milk production when away from your baby. Here is a more complete list. Hand warmers or warm compress, photo or video of your baby, nursing pads, extra parts for your pump, such as membranes, duckbill valves, bottles to collect your milk, milk storage bags, ice pack and mini cooler, a clean towel or cloth to put your clean pump supplies on as you set up, and cleaning supplies, such as dish soap, quick clean wipes, or microwave sterilizing bags. Important nutrients of focus. While there are no foods a nursing mom should eat or not eat, it is best to eat a variety of foods, as close to their whole food state as possible. The nutrient content of your milk will vary depending on your diet, and nursing moms need some of the vitamins and minerals to support lactation and a healthy milk supply. Due to this higher demand for nutrients during pregnancy and nursing, almost half of pregnant and breastfeeding women have a nutrient deficiency. The best way to make sure you are getting all of the nutrients you need is to eat a variety of fruits, vegetables, lean meats, plant-based protein food sources, and fats to ensure you are meeting your nutrient needs. Continue to take your prenatal vitamin, and that's also a great idea just to help make up for any deficiencies that may present in your diet. Regardless of your nutrient status, it is important to remember the benefits of breastfeeding your baby outweigh the risk of a nutrient deficiency. Both you and your baby benefit from breastfeeding. Since we are talking about your self-care, we will only review the physical and emotional benefits for you in this module. Physically, your benefits of nursing include less risk of postpartum depression, more positive mood, less chance of anemia, promoting weight loss after birth, lower risks of breast and ovarian cancers, less chance of developing diabetes, cardiovascular disease and hypertension, and as you age, less chance of osteoporosis. Emotional benefits of breastfeeding include a natural release of soothing hormones oxytocin and prolactin, promoting stress reduction and positive feelings, increased calmness since breastfed babies cry less overall and tend to have less viruses and ear infections, and it also promotes bonding with your baby, reducing social and behavioral problems in both children and adults. Now let's move on to some nutrients. Fat is an important nutrient for your baby's brain and eye development. The fat content of your milk can depend on your diet, your fat stores, and the amount of fat synthesized in the breast for your milk. If your diet is lower in fat, the tissue in your breast will decrease the fat content of your milk. The types of fat in your diet will have a direct impact on the fat in your milk. Higher intakes of processed foods and vegetable oils will increase the omega-6 fat in our bodies and breast milk. Higher omega-6 fat is not ideal because it displaces the good omega-3 fats and DHA. Two essential fatty acids are linoleic and alpha-linoleic. They are essential because our body cannot make them. They are the building blocks for arachidonic acid, or ARA, and docosahexaenoic acid, DHA. Both are important for brain and eye development. The content of DHA in breast milk is dependent on mom's diet. On the other hand, the content of ARA in human milk does not seem to be linked to maternal diet. Since there is significant brain development in the first 2 years of life, it is important your baby receives DHA from breast milk or DHA and ARA supplemented formula. You should include the following DHA food sources: seafood and fish, eggs, grass-fed beef or supplements such as cod liver oil, fish oil, krill oil, or an algae-based DHA supplement if you are vegetarian or vegan. Like DHA, the trans fat in mom's diet will directly impact the amount of trans fat in your milk, and there's no safe level of trans fat for you or baby. Trans fat can disrupt normal cell membrane structures and damage insulin and hormone signaling, which can lead to a predisposition of obesity and diabetes. Trans fats are found in partially hydrogenated oils, margarine, shortening, bakery goods, and commercial frying oils. Recent legislation has banned trans fats from foods. However, it is important to look at the ingredients from partially hydrogenated oils. Food manufacturers can say a food is trans fat free and list 0 grams of trans fat on the nutrition facts panel if a serving contains less than 0.5 grams of trans fat. If you eat multiple servings of the product, you will increase your trans fat intake. Prebiotics, probiotics, and fermented foods. What are prebiotics, probiotics, and fermented foods, and what do I need to know as a new mom? Let's start with definitions and some basics. Our gut contains bacteria. The good bacteria helps with digestion, synthesizing vitamins, helping with immunity, and producing anti-inflammatory compounds. Probiotics are the naturally existing bacteria and yeast found in your GI tract and in fermented foods. Probiotics will help maintain the balance in your body. The good bacteria will fight the bad bacteria to restore balance and help your immune system and help to control inflammation in your body. Prebiotics are the food for probiotics. They are microorganisms found in fermented foods. Prebiotics are not digestible and are responsible for feeding and promoting the growth of the good bacteria in your gut. A healthy gut microbiome can improve digestion, absorption of nutrients, and can boost the immune system and mood. It is not necessary to take a supplement of either prebiotics or probiotics since they are both naturally found in many foods. Prebiotics are found in high-fiber foods such as fruits, vegetables, and whole grains such as bananas, eggplant, onion, garlic, oats, yogurt, and legumes. Food sources of probiotics are fermented vegetables such as sauerkraut, kimchi, and pickles, fermented fruits such as chutneys, jams, and pickled jackfruit, yogurt, kefir, kombucha, and miso. Be sure to read the product labels and choose the product that contains active and live cultures. Probiotics are not absorbed by the body. They are specific to the GI system. Therefore, probiotics are not likely transferred to breast milk. Since probiotics are not transferred through breast milk, if you feel a benefit from taking a probiotic or eating foods containing probiotics, it is likely safe. It is worth noting human milk or breast milk naturally contain probiotic and prebiotics and influences your baby's gut microbiota and immune system. For helpful ways to increase your intake of pre- and probiotic foods, refer to the handout Pre- and Probiotic Recipes. For other questions or suggestions on how to get more pre- and probiotics in your diet, reach out to your NutriVantage Mom's dietitian. Meal planning techniques. Meal planning. We know what you are thinking. Who has time to plan? I barely know what I'm doing 2 minutes from now, and now you're asking me to think about a meal a few days from now. Taking as few as 10 minutes a few days a week to plan meals will save you time and you'll be less stressed. Start by writing down your comments for the week and commitments that will involve a meal. This may eliminate a few meals that you may need to plan. Next, add a few family favorites to the plan. Each week, be sure to add 1 or 2 of those family favorites. As you try new recipes, take notes about how easy it was to cook, if it was liked by your family, and having theme days can help lighten your decisions as well. For example, Meatless Monday or Taco Tuesday. Cooking enough for leftovers can also be helpful to have leftovers on Thursdays or to take for lunch the next day.